Healthcare-acquired infections kill more people than breast cancer and automobile collisions combined. My name is Chloe Ferguson, and today we will discuss what steps healthcare workers and you can take to prevent the spread of infectious diseases. These steps are a part of infection control and routine practices. The red dots that you see in the picture represent where these infectious agents can be found. These germs can cause infections, and therefore our goal is to stop or reduce the transmission and spread of infections. The chain of transmission consists of 6 links which can lead to infection. However, all links must be closed for infection to develop. The first link includes infectious agents which are extremely small microorganisms or infectious agents such as bacteria or viruses. The second chain is where the agents live and grow, and they are called reservoirs. That bacteria or virus could live on animals, on food, on water, on myself, or even you. The next one is how the microorganisms exit the host, such as blood, secretion, or skin. The fourth link would include the mode of transmission, so from one host to the other. This could be transmitted by touch or even through the air. When the agent finally reaches the other host, the link includes the portal of entry, so through your eyes, through your nose, or your mouth. And then the last link of the chain includes a susceptible host. An infection would more likely develop in a very young or very old individual, or someone with a poor immune system. By breaking even one of these links on the chain could possibly prevent the transmission of infectious agents. Now, there are many ways that you could use to break that chain, such as hand hygiene, cleaning and sterilizing any equipment used, managing body fluids like sneezing into your shoulder as opposed to your hands, proper personal protective equipment, or even just having a healthier lifestyle. It's been proven that regular hand hygiene is the most important and effective way to prevent the spread of infectious diseases. Now, there are 2 ways to perform hand hygiene. This includes washing your hands for at least 15 seconds with soap and water, or alcohol-based rub. Now, alcohol is preferred up to 90% of the time if your hands aren't visibly soiled. Your hands are the common link between you and another person or a piece of equipment that you come into contact with. So it's important to know that you should wash your hands before and after you have contact with the patient's environment, so when you're walking into that room and when you're walking out, and then also before and after a procedure or any actual contact with that patient. Now, bacteria or agents are invisible to the naked eye. Now, to put this in perspective, let's try a little experiment. As you can see, we are in the dark. Now, you can see what truly exists on your hands if you do not wash your hands for even 2 hours. This is a glowing germ pool that exists on your hands. Okay. Washing techniques will remove all that simulated germ gel, which also means that it's removing most bacteria. So to efficiently remove that bacteria, wash your palms the back of your hands, in between your fingers and your thumbs, the back of the fingers, and your fingernails, because lots of germs can build up there. And also, a lot of people forget to wash their wrists as well. Now, don't forget that jewelry or cracked or dry skin and long nails or chipped nail polish also act as reservoirs for infectious agents. Personal protective equipment, or PPE, is also used to protect yourself or others against infectious diseases. You select PPE based on your risk assessment and type of infection, such as gloves, gown, mask, and eye shield. These should be used before and after that hand hygiene and should be removed after each use. Lastly, it's important that you sanitize and wipe any equipment that a patient uses. As you saw in that hand germ activity, germs or infectious agents can live anywhere, even if you can't see them. If we are diligent with regular hand hygiene, wearing proper PPE, and cleaning all equipment, this will break that chain of transmission. And these simple tasks could save someone's life by practicing infection prevention and control. Thank you.